All right, so this week we're going to be looking at the lower limb or the lower extremities, and I'm going to be going through some of the cadaver and model images. We'll start out with the cadaver images. We'll show the muscles, the neurovascular structures, and then we'll look at the joints and the ligaments with some of the model images at the end. So we're starting out here with the anterior thigh or hip region. And just for reference, we've got the hip located up here. We've got the knee located down here. And so this is going to be the right side. What we're seeing here are the neurovascular structures, so the vein, artery, and nerve in the center here. And then we'll talk about some of the muscles from the lateral all the way to the medial. So first off is the iliotibial band or the iliotibial tract. It's the most lateral structure or muscle here. It's part muscle, part tendon, and it's one of the hip flexors that we see here. It goes all the way down to the tibia from the ilium. Next, we have the sartorius. The sartorius is this strap muscle, crosses the thigh. It starts from the lateral aspect of the hip and goes all the way across, inserts in the medial aspect here. Then we've got the iliopsoas. So the iliopsoas is actually a combined muscle. It's formed by the iliacus. So it's just this part here, the central part here. I'll talk about what this part is, the lower part. That's actually the rectus femoris, which is right underneath the sartorius. But this small strip here, which is forming the lateral border of the neurovascular structures, is the iliopsoas, formed by a combination of the psoas muscle and the iliacus muscle, which are muscles that we'll talk about in a future system when we talk about the posterior abdomen. Crossing over the neurovascular structures, the next muscle here, which forms the medial border of these vessels, is the pectineus. So it's darker in this cadaver, and it's a medial structure that's kind of being the bed for these neurovascular structures, and that is the pectineus. Then we've got the adductor longus. So the next three muscles are actually a group of muscles called the adductors. They help to adduct or draw the thighs together, starting with the longus, which is the long version of this muscle. Deep to that, we have the brevis being shown by the arrow here. So it's a much smaller muscle. It's also deeper to the longus. So I'm going to have to kind of retract, as you can see here, the longus in order to get a better view of that brevis. We then have the adductor magnus. The adductor magnus is going to be the larger of these three muscles, and it's going to go all the way deep into the thigh. So the adductor longus, adductor brevis, and adductor magnus. The most medial muscle of the thigh is the gracilis. So it's also a strap muscle, very similar to the sartorius here in its long, elongated appearance, and that is going to be the gracilis. As I mentioned earlier, this muscle, which is somewhat hidden here, right on top of the thigh, underneath sartorius, is the rectus femoris, one of our quadricep muscles. Another view of the anterior thigh here. So this is a lateral view. So this is going to be on the left side. Again, reference points are the hip, which is on this side, the knee, which is toward this end. And so we get a nice view of the thigh on the left side here. So we got the gracilis here, the medial most muscle again. We've got the adductor longus here. This time the brevis is not being shown because it's being covered. The longus is not being attracted enough for us to see the brevis from this view. We then see the pectineus. So again, that smaller strip, triangular shaped muscle, which is the medial border of where we have the nerves, arteries, and veins. Then we get the vein, femoral vein that is, femoral artery, and femoral nerve. And then the branch that's coming off of the femoral artery, which is being shown by the arrow here, is the profunda femoris, also termed the deep femoral artery. Okay, so femoral vein, femoral artery, femoral nerve, and then the profunda femoris or deep femoral artery. And notice how the vein is much different in its appearance, right? It has a flatter or thinner wall. It's more discolored because we can see right through that structure. The artery is a lot more turgid. It's, more substantial. It's holding its shape, and it's more elastic. If you were to touch on that artery, it would bounce right back, and that can be appreciated here. And then the nerve here is kind of branching off to supply these muscles. On the lateral side here, we've got the Iliopsoas that I mentioned before, then the Sartorius crossing the hip joint, this long strap muscle, and then the iliotibial tract or iliotibial band, which is running right along the peripheral aspect of the entire thigh. We can also appreciate the vastus lateralis, the rectus femoris on top, and then a little bit of that vastus medialis, which I'll show on a different view. Okay, so here's a much clearer view of the entire thigh. Here we can see vastus medialis. So we're looking at a different view. The hip is on this side this time. The knee is on this side this time. We're looking at the right lower extremity or the right thigh. And this is the right vastus medialis, the right rectus femoris running all the way through the knee here. And then we can see a bit of that right vastus lateralis. Now, vastus intermedius, or intermedialis, excuse me, is going to be underneath the rectus femoris. So we can see a little bit of that kind of peeping out here. Again, iliotibial tract on the lateral aspect, Sartorius running across there, the Iliopsoas here, femoral nerve, femoral artery with the deep femoral branching off, and then femoral vein, Pectineus, Adductor Longus, and Gracilis. Looking at the posterior hip and thigh region, so we're seeing the gluteal muscles here, and the Gluteus Maximus has been retracted, as well as the medius. So it's really important to kind of flap these muscles over in order to see the deeper structures, including the sciatic nerve. So this is the cut surface of that Gluteus Maximus, which is this largest really of the three gluteal muscles. Deep to the Gluteus Maximus, which is on this side here. And just in terms of our reference points, this we said is the hip. This is the right side. This is the left side because this cadaver is now prone. Okay, so we've got the gluteus medius on the right here, gluteus medius on the left, and then the smallest of our three gluteal muscles are the minimus. So gluteus minimus here on the left and gluteus minimus here on the right. Now these muscles are going to be above the sciatic nerve along with the piriformis. So the piriformis is a smaller muscle here. It's really close to the gluteus minimus, which is up here. Here it goes on the right. So the piriformis on the right, gluteus minimus on the right. And these are muscles that are above or superficial to the sciatic nerve. So here's the sciatic nerve emerging through the gluteal region and going down towards the posterior thigh. Below the sciatic nerve, we have the other gluteal or gluteal region muscles. So we start with the superior gemellus, the smaller muscle here. In between is the obturator internus. The lowest of the three here is going to be the inferior gemellus. So that's superior gemellus, obturator internus, and inferior gemellus. Okay, and again, these are going to be deeper or lower to the sciatic nerve, which is emerging here. On the other side, we can see these muscles as well: superior gemellus, obturator internus, and then inferior gemellus. Now, the fourth and final muscle below these three is going to be the Quadratus Femoris. All right, Quadratus Femoris, it's a square-shaped muscle, hence the term quadratus. It's got 4 even sides, and here it is on the right. Here it goes on the left. Just to go over this one more time in order: Gluteus Maximus, Gluteus Medius, Gluteus Minimus, piriformis, superior gemellus, obturator internus, inferior gemellus, sciatic nerve, Quadratus Femoris. All right, moving down into the posterior thigh here. So these are the muscles that are on the back of the thigh. Hip is here for reference, knee is here for reference, and so this should be the right thigh, or the right posterior thigh. We can see the biceps femoris, which is the lateral bulky muscles. All 4 of these muscles, by the way, are the hamstrings. These are going to be the back muscles, and we can see them here. So the biceps femoris going on the lateral aspect of the knee. On the medial aspect, we've got the semitendinosus. Semitendinosus has a prominent tendon, which you can appreciate here, versus the semimembranosus, which is the more bulky of these 2 muscles. So semimembranosus, which is being shown by the arrow here, versus semitendinosus, which is the medialmost muscle. And then we can see that gracilis. We talked about gracilis on the anterior aspect, and we can appreciate it here from a posterior view as well. Now, running in between these hamstring muscles is that sciatic nerve. So we would have showed where the sciatic nerve emerged from the gluteal region, and then here's the rest of that nerve as it emerges in between the heads of the hamstring muscles here. So right in the center here, it's then going to divide into two branches. It's got the common peroneal, otherwise known as the fibular branch. And then it's got the tibial branch, which goes right down the posterior and into the posterior leg. Also, deeper to the tibial branch of this nerve here, we can see the popliteal vein on the top here, and then the popliteal artery below. Another thing here, notice again how the vein is darker because we can see right through the wall. It's a thinner wall versus the artery that is more patent, more opaque, and we can't really see the contents. Also worth noting is the order of these structures. So the vein is always on top of the artery until they emerge into the leg, where the vein goes medial and the artery goes slightly more lateral. So here is our popliteal region, also called the knee region. This is at the back of the knee. We're seeing the medial hamstring muscles here. So this is our semitendinosus with this more prominent tendon, semimembranosus, and then on the lateral aspect, the biceps femoris. Here's the sciatic nerve emerging, a more zoomed in view of the sciatic nerve here dividing into the common peroneal branch. This will also then further divide into the superficial fibular or superficial peroneal and the deep fibular or deep peroneal. And then from that, we've got the tibial branch, which goes right down into the posterior leg. We're also seeing the popliteal vein again, which is on top of the popliteal artery, which is slightly lower. Looking lower down into the leg, here we've got a lateral view of the left leg. So here is the Gastrocnemius muscle, the bulky muscle that forms the calf, Beneath the gastrocnemius is the soleus muscle. This is the muscle we would have talked about as being really important for posture versus the gastrocnemius, which is really important for power and for strength and movement. Both of these muscles join together to form the calcaneal tendon or the calcaneus tendon. That's going to insert on the calcaneus bone of the foot itself, one of our tarsal bones. Other structures we can appreciate here are the fibular muscles. So there's the fibularis longus, which is a long version of this muscle. And then deep to that is the fibularis brevis. We can see its tendon here, which is the shorter part or version to that muscle. So fibularis longus and then fibularis brevis. And these are going to be muscles that help to evert the foot or help with lateral movement of the foot. Posterior leg region here. So we've got the knee here, which is more proximal. We've got the ankle here, more distal. And this is going to be our, the lateral aspect here. So here's the lateral aspect, here is the medial aspect, and so this would be the left leg. You can appreciate some of the vessels here. So here's the popliteal vein and artery, slightly lower, right? These are running through the knee region, through the popliteal region, and then into the posterior leg. We can see that they divide into the posterior tibial artery and vein. So here's the posterior tibial vein and the posterior tibial artery. The anterior tibial artery and vein are hidden from this view because they will pierce the leg and emerge on the anterior aspect. The third branch of our popliteal vessels are the fibular vessels. So here's a fibular vein, again, slightly darker being shown here, and then the fibular artery, which is accompanying that vessel. So fibular artery, fibular vein, fibular artery. These are also termed the common peroneal vein or common peroneal artery. The posterior tibial vein and posterior tibial artery, and then the structure that we're seeing emerge right down the back here is the tibial nerve, which is a branch of the sciatic nerve. Here is going to be that common peroneal branch of the sciatic nerve, which is emerging on the lateral aspect, as I mentioned earlier. It's going to divide into the superficial peroneal and the deep peroneal, also known as the superficial fibular and the deep fibular. Here's a better view of that. So sciatic again here, tibial nerve going right down the back, common peroneal dividing off to the side, and then further dividing into the deep and superficial peroneal or fibular. Here is the fibularis muscles again, so fibularis longus, fibularis brevis, and then we can see a bit of that superficial peroneal branch that's coming from that common peroneal nerve. Here is that superficial peroneal branch, which is the division that's coming from the common peroneal or common fibular nerve, and this one emerges on the lateral aspect of the foot. Now let's look at some of the foot muscles here. So we have the extensor hallucis longus being shown here. And this is not to be confused with the extensor hallucis brevis. Again, the longus being the long version coming all the way from the foot. Here is the tendon of that muscle, versus the brevis being the short version, which is only running on the top of the foot. So extensor hallucis longus versus extensor hallucis brevis. We can also appreciate the digitorum to these extensors. So here's the extensor digitorum longus coming all the way from the foot versus the shorter extensor digitorum brevis, which is running on the top of the foot. And these have a combined tendon, but they branch out going to each of the 4 lateral digits. So again, we're seeing here the extensor hallucis brevis. So again, that short muscle that's going just to the great toe. The word hallucis means great toe. And so there's got the short version extensor hallucis brevis versus the long version extensor hallucis longus. And then here are the digitorum muscles, so the extensor digitorum longus versus the extensor digitorum brevis. All right, let's look at some of the ligaments and the joints. So here is the knee joint. We can appreciate the lateral ligaments here. So here's the femur, here is the patella and the patella ligament. Here is the tibia, which is more inferior. And here is that left lateral collateral ligament. So because this is the lateral aspect, because this is the left leg, this is going to be the left lateral collateral ligament, which goes from the femur to the fibula, which is located here. So here's the tibia, here's the fibula. Looking at the bottom of the foot here, we can see the flexor digitorum brevis. So this again is the shorter version of the flexor muscles here going to the lateral digits. And that can be distinguished from the flexor hallucis brevis, which is going to the great toe. So flexor digitorum brevis versus flexor hallucis longus, rather. This is the longus and this is the brevis. Another view of that, here we're actually retracting that flexor digitorum brevis, which is this muscle out here, and showing the deeper muscle, which is the flexor digitorum longus. So this is a very similar thing that we saw on the front of the foot. There is a longus and a brevis version. On the underside of the foot, the brevis versions are going to be more superficial, whereas on the top of the foot, the brevis versions were deeper. So here is that flexor digitorum brevis, which is more superficial, the flexor digitorum longus, which is deeper, can be seen here, and these two muscles are going to the lateral toes, they're going to be the flexors of the lateral toes. That can be contrasted to the flexor hallucis muscles, which are going to the great toe only. So here is the flexor hallucis longus muscle, which is slightly deeper than the flexor hallucis brevis muscle. Again, both of these going to the great toe. The other joints and the ligaments here, so we talked about the lateral collateral ligament. Here is the medial collateral ligament, which goes from the tibia up to the femur. And then we can appreciate the menisci. So the menisci are these cartilage-lined surfaces that help to articulate the femur to the tibia. So we've got the lateral meniscus and the medial meniscus. And then we can also see the anterior cruciate ligament and then slightly deeper, the posterior cruciate ligament. Now, the best way to discern lateral from medial is to look for the side that has the fibula. So the side that has the fibula is going to be the lateral side, hence this is the left lateral, or sorry, this is the lateral collateral ligament. Here is a view of some of these structures on one of our cadavers. So we've opened up the knee joint here. We can see the patella tendon coming down. Here's the femur. Here's the tibia. Here's the fibula on the lateral side. And so this is the lateral collateral ligament going from the fibula to the femur. This is the medial collateral ligament going from the tibia to the femur. And then we can see the posterior cruciate ligament kind of hidden here versus the anterior cruciate ligament, which is much more visible. Some of the hip ligaments that help to articulate and secure the hip joint to the femur. We've got the ischiofemoral ligament going from the ischium to the femur, hence the term ischiofemoral. On an anterior view, we can see the pubofemoral going from the pubis to the femur, hence the term pubofemoral. And then the iliofemoral is this Y-shaped ligament going from the ilium to the femur, hence the term iliofemoral. It's actually got two parts or two heads that attach or insert onto the femur. So that is all for our structures this week.